Internists occupy a unique role in healthcare. They are experts in a spectrum of diseases and complex illness, earning the moniker, the doctor's doctor. Internists use their vast knowledge, experience, and skill to identify the best possible treatment strategies, making them scientific puzzle solvers. They are proponents of extensive clinical research, evidence-based medicine, and continuing education, fueled by the commitment to provide high-value patient care that balances science and compassion. In 2023, the Philippine College of Physicians celebrates 70 years of excellence and service above game. Driven by passion, constancy of purpose, and prudence in internal medicine. Take part in the 53rd Annual Congress of the Philippine College of Physicians on May 7 to 10, 2023 at the Philippine International Convention Center. Together, let's revisit all that we've become and move toward all that we can be. With the Philippine College of Physicians well on the road to 70, the pre-convention series continues to pave the way for its 53rd Annual Congress. Following the Nutrition Summit on January 31, 2023, up next is the second Internal Medicine Bootcamp. Must-know hacks, high-yield advice on clinical knowledge and skills. This two-day bootcamp is slated on February 24 and 25 at the Philippine International Convention Center. Day 1 is a plenary session to be mounted in a hybrid format and welcomes all residents. Whether you're at the venue or on the virtual platform, you will have the opportunity to learn from the experts on relevant topics in rheumatology, dermatology, pulmonology, hematology, infectious disease, and hepatology. Day 2 brings you parallel sessions to be held on-site at the PICC and is open to senior residents only. Both tracks A and B offer various workshops. Travel the road to 70 with the Philippine College of Physicians. Join the second Internal Medicine Bootcamp. Must-know hacks, high-yield advice on clinical knowledge and skills. Know the tips and pearls and mark your calendars on February 24 and 25, 2023. The Philippine College of Physicians is unstoppable in plying the road to 70, taking you closer to its 53rd Annual Congress, month after month. On the third leg of its pre-convention series of activities, the PCP invites you to take part in the Universal Healthcare Summit, Understanding Strategies, Aligning Perspectives, on March 25, 2023 at the Philippine International Convention Center. The country's finest internists are called to join forces in driving the importance of universal healthcare by gaining more knowledge and insights on its implications in the practice of internal medicine, real-world experience in the local setting, the internist role as a UHC healthcare provider, financial structures and obligations of various Philippine government groups, and the challenges behind UHC. The road to 70 is just around the corner. Be there for the Universal Healthcare Summit to advance your understanding of strategies and align with current perspectives. See you on March 25, 2023. The Philippine College of Physicians is unstoppable in plying the road to 70, taking you closer to its 53rd Annual Congress, month after month. On the third leg of its pre-convention series of activities, the PCP invites you to take part in the Universal Healthcare Summit, Understanding Strategies, Aligning Perspectives, on March 25, 2023. The country's finest internists are called to join forces in driving the importance of universal healthcare by gaining more knowledge and insights on its implications in the practice of internal medicine, real-world experience in the local setting, the internist role as a UHC healthcare provider, financial structures and obligations of various Philippine government groups, and the challenges behind UHC. The road to 70 is just around the corner. Be there for the Universal Healthcare Summit to advance your understanding of strategies and align with current perspectives. See you on March 25, 2023. Internists occupy a unique role in healthcare. They are experts in a spectrum of diseases and complex illness, earning the moniker the doctor's doctor. Internists use their vast knowledge, experience, and skill to identify the best possible treatment strategies, making them scientific puzzle solvers. They are proponents of extensive clinical research, evidence-based medicine, and continuing education, fueled by the commitment to provide high-value patient care that balances science and compassion. In 2023, the Philippine College of Physicians celebrates 70 years of excellence and service above gain, driven by passion, constancy of purpose, and prudence in internal medicine. Take part in the 53rd Annual Congress of the Philippine College of Physicians on May 7 to 10, 2023 at the Philippine International Convention Center. Together, let's revisit all that we've become and move toward all that we can be. The Philippine College of Physicians is unstoppable in plying the road to 70, taking you closer to its 53rd Annual Congress, month after month. On the third leg of its pre-convention series of activities, the PCP invites you to take part in the Universal Healthcare Summit, Understanding Strategies, Aligning Perspectives, on March 25, 2023. The country's finest internists are called to join forces in driving the importance of universal healthcare by gaining more knowledge and insights on its implications in the practice of internal medicine, real-world experience in the local setting, the internist role as a UHC healthcare provider, financial structures and obligations of various Philippine government groups, and the challenges behind UHC. The road to 70 is just around the corner. Be there for the Universal Healthcare Summit to advance your understanding of strategies and align with current perspectives. See you on March 25, 2023.
Let us put ourselves in the holy presence of our Lord. Our dearest Heavenly Father, thank you for making all things possible. We are grateful for all the blessings you are pouring upon each one of us, despite the challenges we are all currently facing. Thank you for blessing us today with the wonderful opportunity to meet virtually and learn together in the awesomely exciting webinar. May your blessings of wisdom and guidance be upon us, all through the sharing and impartation of knowledge and skills by our resource speakers, facilitators, and moderators. May all of us learn together, upgrade our competencies, and capacitate us to be the help in the development of our learners' lives and communities in the spirit of your love and generosity. May we now humbly commit every part of this webinar to you as we all bring you the glory, honor, and praises for your kingdom and holy name's sake. All this we pray in the precious name of our Lord and Savior Jesus Christ. Amen.
The Philippine College of Physicians, through the Committee on Media Communication and Health Forum, presents its bi-monthly lay forum to promote the advocacies and mission of the college and its component and affiliate societies. An avenue of accurate and up-to-date conversations with the media and the general public, with timely and diverse topics covering vital public health and medical information, straight from the experts. In a platform that is convenient, accessible, and highly engaging. Welcome to the PCP Health Forum.
Everyone, maganda and welcome to the PCP's Health Forum. Welcome to all the viewers that have attended today. I would like to welcome my fellow PCP colleagues, fellow medical practitioners and healthcare workers, and our very supportive media partners, and our general avid viewers that are viewing this through Facebook Live and YouTube. Welcome to today's Health Forum. So the PCP Committee on Media Communications has collaborated again with the Committee on Climate Change, Environment, and Health to bring us this week's timely topic on climate change, and that deals specifically with the healthcare sector. And the title for our Health Forum today is Global Green and Healthy Hospital. Thank you all for joining us today. I am Doc Kat Tuhino, a member of the PCP Media Communication and the moderator for today's Health Forum. So why do we need to talk about this topic? So climate change in reality has continued to be a detrimental effect on human health due to the alteration of our environment. The healthcare sector has also been a part of the problem due to its large consumption of resources, construction, and operation of complex establishments, employment of energy-intensive technologies, and a wide array of wastes. However, the healthcare sector can uphold and advance a sustainable, resilient, and climate-smart healthcare in our country. One way is through building and being a green and healthy hospital. So to open and welcome us into this health forum, may I now introduce the incumbent member of the Philippine College of Physicians, of the PCP Board of Regents, Dr. Regina Burba, to give us our welcoming remarks.
Hello po, magandang umaga po sa inyong lahat. Galak na galak po akong i-welcome kayo sa isa pang version ng ating media forum every Tuesday. And the topic is very close to my heart kasi to all our hearts kasi talagang nagfo-focus na tayo ngayon that we are trying to transition from the post-pandemic na talagang nagbuhos ng maraming problema sa ating environment. So, maganda po na tamang-tama na ito ay tatalakayin natin. Ano ba yung Global Green and Healthy Hospitals? So, nagte-thank you na tayo po kaagad kay Dr. Sheila May P. Zonza, who will be helping us understand these concepts, as well as Sister Arcelita Sarnilia. So, maraming salamat rin po sa ating usual viewers and media partners for making this forum very successful. So, wala na po akong dadagdag na introduction. Go ahead na tayo sa ating very important topic. Again, in behalf of the Board of Regents of the Philippine College of Physicians, welcome po sa ating PCP Health Forum for today. Thank you.
Thank you, Dr. Aberba, for being with us and for graciously opening our health forum. So before we start our session, may I all remind everyone of the rules and etiquette for this webinar. So if we have any questions, you may type and write your questions regarding this topic on our Q&A chat box in the Zoom webinar, as well as in our Facebook Live and YouTube Live feed. Okay. So what is a green and healthy hospital? So according to the Healthcare Without Harm, a green and healthy hospital is a hospital that promotes public health by continuously reducing its environmental impact and ultimately eliminating its contribution to the burden of disease. So a green and healthy hospital recognizes the connection between human health and the environment. So for our health forum, we have not just one, but two speakers to talk to us further on the concept of what a global green and healthy hospital is all about, and its programs and benefits for its members, and to rally and inspire the healthcare sector and institutions to advocate for a global green and healthy hospital and to become part of the global green and healthy hospital collaboration. So I would like to introduce our first speaker. Our first speaker for today is Dr. Sheila May Pisonza. She had her medical degree at the West Visayas State University, and she had her IM residency training at St. Paul's Hospital of Iloilo. She also had her fellowship training in gastroenterology in St. Luke's Medical Center and her interventional hepatology training in Gifu University Hospital in Gifu City, Japan. She is also, of course, a fellow of the Philippine College of Physicians, and she was the past president of the PCP West Visayas Panay chapter. She is also a member of the Climate Change Committee of course, the PCP, and she was a recipient of the 3 Green Merit of PCP for 3 consecutive years during her chairmanship of the Advocacy Committee of PCP West Visayas Panay chapter. She's also an active consultant at St. Paul's Hospital of Iloilo. May I now welcome our first speaker for today, Dr. Sheila Pisonza. Welcome, Doc Sheila.
Good morning, Doctor.
Morning po.
Okay, so good morning, colleagues and fellow protectors of Mother Earth. So before I proceed with my brief talk, I would like to express my gratitude to PCP, Committee on Media Communications, and Committee on Climate Change, Environment, and Health for giving me and Sister Arce the opportunity to discuss about Green Hospital. And to proceed, I was given this task to discuss on global green and healthy hospitals, the generalities of global green and healthy hospitals. Next slide, please. So it is a recognizable fact that we are living, previous slide, please. Okay, thank you. That we are living in a crisis of both public health and crisis in the environment. We in the health sector, sadly, are also contributors to the ongoing crisis in the environment with the generation of health waste, chemical contamination, and unsustainable resource use. But the important thing is that we recognize this flaw and make solutions. And a major contribution to the solution to climate change problem is engaging in the global green and healthy hospital strategy. To quote, the Global Green and Healthy Hospitals Agenda is an effort to build on the good work happening around the world and engender an approach to sustainability and health that can be replicated by thousands of hospitals and health systems in a diversity of countries and health settings. Next slide, please. So GGHH is one of the programs of Healthcare Without Harm. If we search Healthcare Without Harm in the internet, we will be directed to its homepage. So this is how it looks. Now, under the Our Programs heading is the Global Green and Healthy Hospitals. So before we proceed to our discussion on GGHH, let us get to know a bit about Healthcare Without Harm. So it is an international non-government organization that works to transform healthcare worldwide so that it reduces environmental footprint, becomes a community anchor for sustainability, and a leader in the global movement for environmental health and justice. So it has 3 regional offices based in Brussels, then in Manila and Washington. And these offices collaborate with member nations, member hospitals in the different nations in South America or Latin America, Europe, Southeast Asia, and the United States of America. So we are fortunate that we have a regional office here in the Philippines. Next slide, please. So let's go back to the discussion on Global Green and Healthy Hospitals. So what it is about. So it is an international network of hospitals, healthcare facilities, health systems, and health organizations dedicated to reducing the environmental footprint and promoting public and environmental health. It has more than 1,500 members in 75 countries who represent the interests of over 60,000 hospitals and health centers. Next slide, please. So previously, our moderator has defined what the Green Hospital is about. There is no global standard that defines what a green and healthy hospital is or should be. But in essence, it can be defined as follows. A green and healthy hospital is one that promotes public health by continuously reducing its environmental impact and ultimately eliminating its contribution to the burden of disease. A green and healthy hospital recognizes the connection between human health and the environment and demonstrates that understanding through its governance, strategy, and operations. It connects local needs with environmental action and practices primary prevention by actively engaging in efforts to foster community environmental health, health equity, and a green economy. So basically, when one institution becomes a green hospital, its practices will be geared towards the benefit of our planet and, of course, us, the inhabitants, because we are interrelated with the environment. Next slide, please. So the Global Green and Healthy Hospitals have programs. So these are the agenda and its sustainability goals. And secondly, the Green Health Challenges, which have 3 categories: waste challenge, energy challenge, and healthcare climate challenge. So first, next slide, please. We go to the agenda of GGHH. So the agenda sets out to support existing efforts around the world to promote greater sustainability and environmental health in the health sector, and thereby to strengthen health systems globally. This particular document it provides a comprehensive framework for hospitals and health systems everywhere in the world to achieve greater sustainability and to contribute to improved public health, environmental health. So this framework consists of 10 interconnected goals. So each contains a series of action items that hospitals and health systems can implement. There are tools and resources to support implementation, and these are available on their website, the www.greenhospitals.net or www.noharm.org. You can download it for free. So most hospitals will want to start with a focus on 2 or 3 goals and chart a course for specific steps to achieve them, with plan to subsequently move on to the next challenge. So this is a comprehensive environmental health agenda for hospitals and health systems around the world. It contains all the 10 agendas and action items, and of course, the specific tools on how to achieve this specific goal. So let us go to the 10 goals. Next slide, please. So these are the comprehensive framework of 10 interconnected goals of GGHH. So firstly is leadership. So leadership is the number one goal that a hospital must achieve. So because it is very important that we have a very dedicated and goal-oriented leader in all levels. So the goal of leadership is to prioritize environmental health. Secondly is chemicals. This is the intent of this goal is to substitute harmful chemicals with safer alternatives. And number 3 is waste, and the goal of which is to reduce, treat, and safely dispose of healthcare wastes. Number 4 goal is energy. This is to implement energy efficiency and clean renewable energy generation. Number 5 is water. This is to reduce hospital water consumption and supply potable water. 6 is transportation. The goal is to improve transportation strategies for both patients and the staff. Number 7 is food. And the intent of this goal is to purchase and serve sustainable, grown, healthy food. 8th is pharmaceuticals. So here, the goal is to safely manage and dispose of pharmaceuticals. Number 9 is buildings. This support green and healthy hospital design and construction. And lastly, purchasing, in which the intent is to buy safer and more sustainable products and materials. So here in this 10 goals, in this document, the member institution will be guided accordingly. So, for example, if you want to achieve, well, you can't achieve all of them altogether. You can work on, as mentioned earlier, 2 or 3 goals, one at a time. For example, you have to start with leadership. Then you'll be guided on how to achieve this. So there are action plans and tips on how to do it. Later, Sister Arce will have tips on that. And you can choose from among these 9 other goals on which you want to achieve. So probably waste, the most beautiful thing to do with the waste. Then you can be guided accordingly on how to do it. And eventually, you can move on to other goals, and hopefully you achieve all the 10 goals altogether. In the end, I mean. Okay, so next, please. So the next program is Green Health Challenges. So this is data-driven initiative. It is designed to help healthcare organizations commit to sustainability goals and track their own environmental projects and efforts. So each challenge contains a series of targets, including like indicators and focus areas that provide a pathway for individual members and for GGHH network as a whole to measurably reduce their footprint. So Healthcare Without Harm has designed these challenges with a multi-tier structure that allows members to pick and choose goals according to their specific capabilities and resources. So this is basically depending on what area you are in, on not really strict. It is based on on your resources in your locality. So this design aims to make the challenges accessible to GGHH members of all sizes, of all levels of sustainability and experience. So through data submission on Hippocrates Data Center, members can report, track, and visualize their progress while contributing to an aggregated global view of GGHH network's efforts to reduce their environmental footprint. So these members can achieve their progress in which Green Health Challenges or Green Health Challenge milestones. They will receive public recognition through the International Green Health Awards. So as mentioned earlier, there are 3 challenges here: waste, energy, healthcare, climate challenge. So they can choose from these 3 categories on which they would want to join. Okay, next, please. So when one becomes a member of Global Green and Health Hospitals, what are the benefits? So these are the following. You are able to connect globally with the collaboration program of other member countries or other member hospitals. And you are also able to access webinar series as well as guidance documents for sustainability action, and the data center, which is Hippocrates. Next slide, please. So these are the example of the things that you can have an access to, like the discussion forums. So these are for members to connect and collaborate with colleagues around the world. Forums provide a virtual space to ask questions, receive recommendations, and share resources. So in a way, you discuss with other member hospitals or health facilities. You can get pointers from them as well in order to improve your own journey towards a green hospital in your locality. And another one is guidance documents. It's a comprehensive and with a global view. The GGHH guidance documents provide a deep dive into the GGHH sustainability goals. And of course, you can have an access to the webinar recordings and presentations covering the 10 GGHH sustainability goals and the latest research in sustainable climate smart health care. And of course, another benefit is you can access and learn from over 250 case studies documenting successful sustainability projects implemented by GGHH members from around the world. So you can have, you can be inspired from all of these case studies. And in that way, you'll be able to get involved and be inspired to becoming a greener hospital. And lastly, this data center, which is Hippocrates, which is an interactive data center where organizations can track or store and visualize their sustainability data on a secure web-based platform. So next slide, please. Another benefit is, for example, this one, a sustainable procurement guide. You can download this. This is a new guide which features stories from 25 healthcare organizations around the globe, which offers a roadmap to develop a sustainable purchasing strategy that prioritizes community and environmental health and safety while reducing costs. And another one is waste guidance document, which sets out strategies for healthcare facilities to meet the target of treating their waste in the most sustainable way possible, from transportation to storage, treatment, recycling, and disposal. Recommended actions in this guide are supported with reference to real-world examples and other resources on successful implementation. So later on, Sister Arce will share to us about the experience of St. Paul's Hospital, particularly in waste, which she is awarded to also about that. Okay. So next slide, please. So as what the Father of Medicine firmly reminds us that as doctors, first, we should do no harm to our patients. At this critical point in time, humanity should be the healers of the sick planet. Thus, we should not do further harm to Mother Earth. Next slide, please. So let us all be part of the solution. Together, we can make a difference. Join the Global Green and Healthy Hospitals family. So my reference for my talk this morning is taken from Healthcare Without Harm, particularly the Global Green and Healthy Hospitals. Thank you, everyone, for taking your precious time to be with us this morning. Keep safe.
Thank you, Dr. Sheila Sonza, for your comprehensive and very informative discussion on what is a global green and healthy hospital. Thank you for giving us an overview of what a GGHH is and the 10 goals that we aim to achieve, the challenges that we can face, and how we can become part of the GGHH collaboration. So to further elaborate on this topic, and I think to give us her experience on this, on becoming a GGHH or a Global Green and Healthy Hospital, I would like to introduce our next speaker. She is Sister Arcelita Arce Sarnillo, or Sister Arce. She is a multi-awardee Global Green and Healthy Hospital. She is an administrator of St. Paul's Hospital of Iloilo. She is also a member of the following organizations. She's a member of the Philippine Nurses Association, member of the Philippine College of Hospital Administrators, member of the Healthcare Without Harm Asia. She's in the Advisory Council and Climate Health Leaders Network. And she is also and has been a strong climate smart and green healthcare advocate for more than 10 years. I would like to graciously introduce our next speaker, Sister Arce Sarnillo. Welcome, Sister Arce.
Morning, Doctora, and this with you all.
Yes, your video is on po.
Sorry. So, first of all, I'd like to thank Dr. Sheila May Sonsa for inviting me here today to share on the St. Paul Hospitals of Iloilo's initiative towards a green global healthy hospital. So the objectives for this morning's talk is to show the interconnectedness of health, climate, and the environment, to share strategies to minimize carbon footprint in healthcare, and to suggest sustainable initiatives to manage healthcare waste. Just a way of sharing about St. Paul's Hospital, we have a legacy of about 130. For this year, we are now 112 years of abounding grace. And it started in 1909 when Monsignor Dennis Joseph Duherty, Bishop of Haro, Iloilo, asked the Sisters of St. Olushard to establish a hospital in Iloilo to take care of the health needs of the Ilonggos and beyond. With that invitation, arrival of 7 sisters, SPC, Pioneer Sisters, and the mission began. So Jesus said in the scriptures, I have come that you may have life to the fullest. That's from John 10, verse 10. But we cannot have healthy people in a sick planet. Health institutions are major drivers of climate change. If healthcare makes up more than 4.4 net global climate emissions, if the global healthcare sector would be a country, it would be the 5th largest emitter on the planet. And this is a challenge for us all in the healthcare industry. And now we can collectively reduce our carbon emissions, which greatly impacts on planetary health. SPHI has 2 advocacies that are being pro-life, being a Catholic institution, and environmental stewardship. Pope Francis, in his message in celebration of the season of creation last September 2022, said that there is a need for a covenant between human beings and the environment. And this has a Trinitarian aspect of God being the creator, man as a steward, and creation. Just a way of flashback on the calamities that changed our lives in the past 4 years. The Philippines is vulnerable to health and climate disasters. We know that more than 20 typhoons pass the Philippine area of responsibility every year. And in 2019, if you remember, we had a dengue outbreak in the Philippines, for which Iloilo had the highest number of dengue cases. I remember when I arrived to St. Paul's that time, patients would stay about 2 days at the emergency room because we could not accommodate them in the rooms. And we know when we call all the pandemic, and as it stays there in September 2022, year 2021 is the deadliest year in Philippine history, with 879,429 deaths among Filipinos, 105,723 or 12% COVID-19 related deaths. Of course, the number could be more if we consider the 2022 number of cases. The economic and social disruption caused by the pandemic devastated millions of people and challenged public health and food systems, especially that the Philippines was known to have the longest time of lockdown in the world. We also recall the different typhoons that have passed our country. Like in November 10 to 12 in 2020, the Typhoon Rolly and Ulysses. Within physical, we know that in these evacuation centers, physical distancing was most compromised. And we realized really that climate, health, and the environment are very much interconnected. And we also recall the very devastating typhoon Odette last December 2021. Just as everybody were preparing for Christmas, then the typhoon somehow came. And last year, for the first time that we would be preparing also for Lent, or it was a Lenten time, in fact, it was supposed to be the beginning of summer. Then we had the Typhoon Agaton last April 2022, which the Western Visayas was badly hit with more than 170 deaths. Now, when Mother Earth sends us a message, Mother Earth is clearly urging a call to action. The environment is made to suffer our wrongdoing. As we see here, that plastics usually clog the drainage system, contributing to floods as well as pollute the sea and endangering marine life. We see this as the turtle being wrapped somehow with plastics. So responding to this call, our initiatives are guided by the 10 goals of Global Green Healthy Hospital, as mentioned earlier by Dr. Sonsa. We have here leadership, chemicals, waste, energy, water, transportation, buildings, food, purchasing, and pharmaceuticals. Now, in our case, we prioritize to manage our healthcare waste. When I arrived in 2019, we had our infectious waste collected, and we paid 3.7 million for the collection of our hazardous and infectious waste. And for me, that was because we were not so serious yet in segregating and sorting the waste, the hospital waste. And so we initiated to observe proper waste segregation and sorting at source by the color coding, and further classification at the Materials Recovery Facility, or the MRF. Now, we assigned to Bioman, the MRF, to finally segregate and sort the garbage. And we have also provided autoclaving machines for infectious waste. So after that, in the next year, in 2020, from a 3.7 million expense of hazardous waste, we only spent 319,000, just less than 10% of what we paid in 2019. Then we also initiated the use of electronic billboard instead of tarpaulin, or it could be a clothpoline, wherein we just ask the local artists to print on the cloth, either canvas or some other cloth materials. And we also initiated the no plastic, no styrofoam policy in the hospital. So just to show our income and expenses, so the healthcare waste. In July 2019, as I said, we had an income of 270,000, but we spent 3.7 million for the collection of our infectious waste. Now, the following year, in April 2020, we had a net income of 130,537, but we only spent 319,080 pesos. In December 2021, we had an income of 186,172 pesos and spent 375,900 for our infectious waste, considering that this was a COVID year. Now, 2022, we had an income of 200,696 and an expense of 891,960. Some of these were a carryover from the 2021 hazardous waste. So also other initiatives, we also practice recycling initiatives wherein crushed glass are mixed as fine aggregate with cement. These are the vials and all other broken glasses. We have a vial crusher here. And so we use the crushed vials and other glass materials to mix with cement during constructions. Of course, we see to it that the metal parts are being segregated also. Then recycle waste and sellable items. So we have the spread, the papers. For the papers, in fact, we still also segregate the white and the colored or the brown paper because the colored papers have less in cost, less in value than the white papers. Then for chemicals, we substitute strong cleaning chemicals to environmentally friendly and economical housekeeping materials like vinegar and charcoal as bathroom deodorizers. This one. And baking soda and cucumber fruit or the kamias for cleaning stubborn dirt in surfaces. So we use them in the bathrooms and other places. And these are all organic materials readily available in the country. Then some plastic containers are utilized as plant pots. Okay. Even for the container of the charcoal as deodorizers, we also use plastic bottles. Then some other recycling initiatives, old toilet tanks utilized as plant boxes. Fruit basket made also from old magazines and newspapers. These are some artistic ways to recycle old items. Then every December we have the contest for the Trust to Work of Arts. This was in 2021, wherein we had the Belen contest. Last year we had the Lantern contest. So they all make use of indigenous or recycled items in their artworks. Okay. Now, during the COVID-19 pandemic, as we know that we were not all ready to face the challenge of using PPEs. And so we initiated to make our own cloth masks and even for the PPEs. These are silver taffeta cloth, which we use as our cover-up. And in fact, when we started, we also make use of a cloth mask wherein we just inserted the surgical mask so that they don't need to change them every day, because we know the scarcity of supplies at that time. In fact, one time we experienced that our orders from Manila were not allowed to be shipped to Iloilo because they said that they need the items more, the PPE items more in Manila than in Iloilo. That's how difficult it was then. And so just to present our savings by using our reusable and sustainable PPEs, we have here, for example, the unit cost of PPE, the disposable ones, would be about 800 pesos. Now, our usage per month, we would use 12,000 sets per month, and that would about amount to 9.6 million for the monthly usage. Now, as an expense for the whole year, it would amount to 115,200,000 pesos. But then because of our sustainable materials, Then we cost it at 500 pesos per piece for the labor and material. And so we bought 1,000, good for 1,500 sets, reusable sets. And we only had a one-time expense of 750,000 pesos. So it gave us a savings of 114,450,000. And until now, we are using the same materials because they are very durable. So we just continue to wash them, disinfect them, and it really still give us more savings. Okay. So in terms of the medical waste, if we have to compute for the expense of the collection for the infectious waste. So we have if we use 12,000 sets per month, it would be about 3 million grams per month because one set is equal to 250 grams. Now with this, it will be all amount to 36,000 kilograms. And if you can multiply it to the cost of collection for the infectious waste at 60 pesos per kilo, you could have spent 2.1 million pesos for the collection. But again, because we reuse them, this is our savings. We already saved 2.1 million in the collection of the hazardous waste or the infectious waste. So the next is leadership. Of course, we spread the advocacy to all our stakeholders, to the medical staff, employees, and patients. And I'm happy that our doctors have made their own initiatives also to being members of other organizations and groups like Dr. Sonsa. We also have Dr. Ferrer and some other doctors who have initiated their own programs towards greening and observing a healthy hospital. So we are members to different ecological groups like the Healthcare Without Harm, the Laudato Si Action Platform of Asia, the RISE Philippines, Laudato Si, and CBCP. SPCI also joined the Healthcare Without Harm Race to Zero campaign to help avert the climate crisis. By April, there will be a training in Taiwan for this Race to Zero campaign. And we have hosted different groups who come to benchmark locally and internationally. Then we had mangrove planting activities. Okay, so then we created the Green Hospital Committee to spread the advocacy in the hospital and even outside the hospital environment. Then we initiated to give plants as gifts during occasions instead of expensive gifts. Then we have our plants. And in partnership with Healthcare Without Harm, we installed an air quality monitoring device in November 2019 to monitor air pollution. And this device monitors a 24-hour period for the air quality. And with this, one of our doctors, Dr. Michelle Bavia, conducted a study on air quality in the vicinity of St. Paul's Hospital, Iloilo, before, during, and after the COVID-19 lockdown. As you can see, the gray lines here is the record during the lockdown. Okay, so, but then when we opened, when the lockdown was over, we could see that the lines have also increased. So we will continue to monitor air quality within the St. Paul's Hospital now that some of the canopy has opened and we have more vehicles passing our area. This device is installed at the security guards at the gate. Now, one of our initiatives also to shift from cut flower to ornamental plants in decorating the chapel and even in other areas of the hospital. So with that, we had a savings of 80,000 per year since 2020. Because if we buy flowers, it's just the flowers could just stay for about 3 days. So we have to change again. But with plants, we just have to maintain watering the plants and probably change only weekly. Now, as I said, some of our doctors have also initiated other programs like the OB-GYN Society, the Panay chapter. They have this organic urban rural gardening livelihood for pregnant women, wherein they conduct lectures and give the patients or the pregnant women starter kits composed of seeds, compost, fermented plant juice, seedbed, and sprayer. It is only cost 138 pesos. The purpose is for the urban gardening is added income for the family or for family consumption. And they have already harvested some of their produce, the chai, all these things. And they continue to conduct lectures so that more women can be involved in the program. Now, used PPEs are utilized as rice pouch for the community pantry during our program for this community pantry. Then also use of cloth towels in the ICU instead of interfolded tissue. So, okay, in some areas we use hand dryers, but because in the ICU the hand dryer could be very noisy, so make use of cloth towels. Also in the operating room, we have also used cloth towels instead of interfolded tissues. And we have fabricated customized stainless needle cutters. So these are being distributed at the laboratory and the nursing areas. Then a shift from plastic to canned and glass bottle drinks. Okay. Then we have organized and celebrated the Earth Week last year, activities 2022, wherein we had plants and art exhibits and lectures, and it was culminated by a tree growing or tree planting and growing of 100 jackfruit seedlings. That's April 23, 2022. Now, just for this year, Dr. Ferrer, who is our chair for this environmental activities, has organized group which she termed Health and Environment Advocates for Life. So we have Dr. Sonsa, in fact, is a member of that team, and we will have other programs, other meetings to somehow to finalize our plans. And for this year, during the Earth Week celebration or the Earth Day celebration, we plan to do coastal cleanup and some lectures again to, in fact, not only in the hospital, but probably in the community. So, now on chemicals, we have also substituted strong chemical cleaning chemicals to environmental friendly and economical housekeeping materials. So we had we use vinegar and charcoal as deodorizers, as I mentioned earlier. And so these are our savings. In 2018, we spent 67,550. In 2019, it was 16,200. And every year, we have diminished these amounts. Then baking soda and cucumber fruit, as I said, for cleaning stubborn dirt. So these are very economical. Other initiatives, the hand dryers instead of interfolded tissues. And instead of compressed Lysol spray, we use Lysol solution in plastic spray. So we reconstitute the Lysol spray itself. Because this one, in fact, the compressed Lysol spray is not also environmental friendly. So we make use of this plastic spray. On energy, we have installed energy monitoring device because in our hospital, we observe activity-based costing for our services. So knowing the energy consumption of a particular equipment can help us in computing the rate per procedure. Like we discovered that the tomotherapy machine at the cancer center spend less or consumes less electricity than the CT scan machine. So for the tomotherapy, in terms of energy consumption, it was only about 480 pesos per procedure, as compared to the CT scan, which consumes or which spends 1,600 plus per procedure. This is the energy monitoring device, and we installed this in different areas. We also signed a 15 years contract with the Timeless Green for 534 kilowatt peak renewable energy. So we have already finished the installation, and we can probably energize this early next month. Now, in July 2019, we conducted an energy audit, for which it was recommended that we have to change our lights to LED. So we now 100% of our lights are already LED. And also to replace our air conditioning units with an inverter to those with inverters. So right now, 54% of our air conditioning units are already with inverter. And we continue to change this as the units get old and due for replacements. Now, I'd like to share some benefits of the renewable energy. It reduces grid energy consumption by about 20 to 25%. And solar panels also act as insulator, especially that we are really a tropical country. The savings on the repainting of roofing, which is done every 2 years, because the solar panels also act as a protector towards the element of the heat and rain. So we do repainting of the roofings about every 2 years. So for last year, we spent 199,000 or almost 200,000 for the repainting. So we can just somehow project that for the next 15 years, we'll not be repainting our roofings. It also prevents incidents of roofing leaks. Other benefits is that fuel supply is a fuel supply that never runs out, it's reliable and resilient, and zero carbon emissions and greenhouse gas, then less global warming. And it somehow provides cleaner air and water, improved public health, a cheaper form of electricity, which is stable energy to stabilize energy prices. In Iloilo, the rate of the kilowatt hour since the early 2022 has more than doubled. In the first quarter of 2022, the rate per kilowatt hour at that time was only about 6 pesos. But this time, it's already 13 pesos and 42 centavos per kilowatt hour. So if we don't do something, we just have to increasingly pay for our energy consumption for the utilities. Last year, in September 2022, there was the treaty, the Health Group's Call for Global Fossil Fuel Non-Proliferation Treaty. Now, what are the components of the treaty? To prevent proliferation of coal, oil, and gas by ending all new exploration and production, and to phase out existing production of fossil fuels in line with the 1.5 centigrade global climate goal, and to fast-track real solutions and a just transition for every worker, community, or country. Usually they would say that the coal mine companies will provide jobs for the community people, but actually in the end, it is not really also sustainable. Now on water, we have installed an ozonator to treat our wastewater, and the gray water is being used to, this is our ozonator at the laundry department. In fact, this ozonator, we use this to wash our PPEs. So we don't need to use strong disinfectants in using our used PPEs. Now, the ozonated water is used to flush the toilets and water the garden. We had it analyzed, and the result was even better than the recommended range from the DENR. So the installed water meter to measure recycled water output and it's 1,380 per cubic meters per month. We also do rainwater harvesting, and backwash water from the RO of the kidney services unit is utilized in the laundry. We install water stations in strategic places to minimize the use of plastic bottled water. Okay. And also the staff were given glass canisters and tumblers to encourage them to bring them while on duty so that they can again utilize the use of bottled waters. On transportation, we have organized the SPSI Bikers Club, wherein we have about 120 members from our staff and doctors. This is again to promote wellness and fitness, avoid exposure of the transmission of virus during the pandemic. It's more economical. They don't need to buy gas. It promotes camaraderie. And of course, our main aim really is for zero carbon emission. So 16 of our employees regularly use bikes as a transportation to work. We also campaign for carpooling to maximize use of service rights and resources, and discourage idling of parked cars for car motor maintenance when not in use. Now, on food, we observe meatless Wednesday and Friday, especially that Lent is coming. And vegetables at the SPCI parking area are utilized in the canteen and dietary department. So our staff are harvesting our proceeds of the vegetables that we have in the parking area. Now, on purchasing, SPCI is a member of or participates in the Healthcare Without Harms SHIP program, supports health and procurement program of Healthcare Without Harm. And we patronize local suppliers to save on transportation and carbon emission. We also use nitrile gloves instead of latex and other eco-friendly items. We campaign for the awareness of companies to use less plastic in packaging of their products and supplies. And in fact, we accredit our suppliers and we ask them how they conduct in their packaging of their supplies. We encourage them to use less plastic. And also we replace battery-operated clocks to electronic wall clocks so that we don't, to avoid the pollution of mercury or of lead in the batteries. Okay. So even for the number of disinfectants, the sunrocks, because we have shifted to vinegar, so these are our savings. Okay. And plastic cling wrap, of course, we are slowly really discouraging the use of plastic cling wrap, especially in the dietary. Then, okay, these are our savings for the bathroom or the toilet bowl disinfectants, the Pugator. So from 185 is 59,000, and since 2020, since 2019, to this we have not really used anymore the Go Getter cleanser. Also, the use of Bygone spray, which is aside from expensive, it is also not health friendly. On pharmaceuticals, so we observe safe management and disposal of pharmaceuticals. For example, the expiring drugs, close monitoring of stocks to avoid expiration of medicines and return to suppliers within 3 months of expiration. Disposal of cytotoxic waste, we observe the delay to decay, wherein we keep them in a safe place from 3 to 6 months before we can dispose of them together with the general waste. And we support local suppliers, again, to lessen carbon emissions and transport. We observe generic prescribing, and we have implemented closed pharmacy practice to avoid counterfeit drugs for patient safety. Empty vials are sterilized and used for biopsy specimen collection. And medicine boxes, in fact, are recycled as medication cards here. And we minimize purchase of pressure metered powder inhalers. We switch to dry powder inhalers and soft mist inhalers to lessen carbon emission. On on anesthetics, we use sevoflurane over desflurane anesthetic because the desflurane has a 10-year lifetime in the atmosphere compared to 1.2 years for the sevoflurane. It has also 26 times global warming potential as compared to sevoflurane. On buildings, we utilize skylight roofing to harness natural light. Also use bricks or pavers in some portion of the hallway, the driveway of the parking to neutralize heat island. And we have operable windows for natural ventilation and lighting. As I said, the cross bias as additional upgrades during construction. And we have the greening of the hospital. Plants use as shield from morning or afternoon sunlight. The building. It promotes well-being and serves as positive distraction to our patients and even for visitors. Okay, these are the plants we have. And okay, so that's the plants, fruit-bearing, flowering plants, herbal, ornamental, and vegetables. And in fact, birds build their nest among the trees around the hospital. In 2021, we planted this tree, Iloilo tree. And we utilized placenta as organic fertilizer. So from a 2 feet size of plant as a seedling, it has now really grown up to more than 6 feet in just about more than a year. So last year, in May 18, 2022, we received visitors, international visitors of Healthcare Without Harm. They were from Indonesia, Malaysia, Laos, Argentina, Vietnam, and the Philippines. They benchmark our practices for the healthcare waste management. And after that, also staff from the Siquijor Provincial Governor's Office and hospital visited SPHI again for benchmarking. And late last year, we received the Waste Management Committee at the Western Visayas Medical Center under the Zamboanga Provincial Hospital, they all came to visit and see our healthcare waste management practices. Now we are facing a challenge here in Iloilo. The rising sea level or the rising sea level. I have seen in the 2021 there was one issue of the Star where in the sea it says that the sea taking back the Plain Bay areas. And I think for our particular experience here, I observed that last year we had more incidents of the seawater seeping into our grounds. And that is really a big challenge for us because we cannot just easily relocate our building being more than a century old building. So we hope that we can really do something. We're trying to study how we can minimize the incidence of the seawater seeping into our place. This was taken last June 16, 2022. So the height of the water could go up to 6 inches along the hallways. So in closing, I'd just like to quote on Pope Francis in Laudato Si. A true ecological approach always becomes a social approach. It must integrate questions of justice in debates on the environment so as to hear both the cry of the earth and the cry of the poor. We know that in every disaster, in every calamity, it's always the poor that will be most disadvantaged. Just very recently, or just this morning, I have seen in the news that less than 2 weeks after the major earthquake in Turkey, Turkey again has experienced again a 6.3 tremor. So we really hope that we know that in the first earthquake incident, there were more than 25,000 deaths. And I hope this time it will not be so many casualties. So thank you and good morning.
Okay. Hi, Sister Arce, thank you so much for sharing your experience in St. Paul's Hospital of Iloilo, the feat that you had to, the goals that you had to achieve in order to become a global, green, and healthy hospital. The challenges that you faced, like yung mga typhoons, especially, of course, the COVID-19 pandemic, and the initiatives that that your hospital did in order to achieve yung 10 goals of the GGHH. We commend you, Sister Arce, and the hospital of St. Paul's Hospital of Iloilo for reaching such a feat. Okay, of course, it wasn't. So it's not impossible to do this. Talaga, no, sister? And we'd like to thank you for sharing your knowledge and expertise on becoming a GGHH, or a Global Green and Healthy Hospital. So now we have come to our Q&A portion. I would like to welcome back Dr. Sheila Sonza for the Q&A portion of this health forum. Now, for everyone who is attending in our Zoom, YouTube, and Facebook, you can still type your questions. I see questions already here in our chat box in Zoom and the Q&A chat box. So let's start, Sister Arce and Doc Sheila, with the question. So here, one question, and any of you, Doc Sheila, Sister Arce, can answer. So what do you think is the first step of a naive hospital, meaning, Doc, wala pa sila masyadong experience, of becoming a global green and healthy hospital? So what do you think can be the first step? Parang if a hospital that siguro not very experienced, what could be their first step to do to achieve?
Okay. So I think the basic, I think the basic principle really of the managing healthcare waste is sorting and segregation at source, and in fact that's in the manual of the DOH, no, for the healthcare waste management, and that's really the very first step, because if we like the biodegradable and non-biodegradable, we know that if we mix paper with the biodegradable, pag nabasa na yon, then it's just really a waste already. But if we are able to really observe properly, then we can really, in fact, we can turn them to cash. No? Yes, from trash to cash, as we have also experienced in our own hospital. It's just a matter really of observing strict sorting and segregation at source.
Doc Sheila, do you have any inputs on how to become, or your first step? So Mr. Arce said the first step could be reducing waste and using biodegradable, or sorting out yung wastes natin so that we could know what is recyclable and what is biodegradable and such. Doc Sheila, your inputs po.
To add to that, to what Sister Arce said, very first step to become is first and foremost to have a committed leader or an administrator, as for example, Sister Arce. Dapat po merong dedicated na leader or administrator in the hospital who will really initiate the move. So in the 10 goals of the Global Green Health Hospitals, the first goal is really leadership. So under that leadership, there are 4 key leadership areas, no, that you need to do. For example, to form a hospital task. Yun din ginawa ni Sister Arce. There's a task force. And you do research and engage the community, and lastly, you go for your advocacy for environmental health policy. So you really need to have a good leader in the hospital. Kaya nga nagkaroon tayo ng Sister Arce Arce was with us in St. Paul's Hospital. Because of her, we have this move from a regular hospital into a, so talagang dapat po merong point person na mag-uumpisa po. So from that point, you can achieve the other goals, to raise the energy.
Okay. Thanks, Doc Sheila. So it takes also one person to start it and a great leader to move the masses in order for us to achieve our goals po into becoming a GGHH. Thank you, Sister Arce and Doc Sheila. Sobrang inspiring and sobrang exemplary of what you've done sa St. Paul Hospital of Iloilo talaga po. Now, for another question here in the Q&A chat box from an anonymous attendee again. It's for Sister Arce. Sabi na po ng attendee, I commend your efforts to keep SPHI green and spread the advocacy of using environmentally friendly products to protect our planet and stop climate change. Regarding the use of towels instead of paper tissues, are the towels intended for single use only, then washed? And do you also use organic detergent for the hospital laundry? Okay, Sister Arce.
Yes, the towels are intended for single use. Then now for detergents, we have not looked into that yet. But as I said, for disinfectants, instead of using Sunrox, then we have installed the ozonator. This ozonator makes use of a high oxygen concentration. So parang kasi di ba aerobic, anaerobic, parang ganyan. So it's the high concentration oxygen that sort of fights the bacteria. And it's very, ang proof talaga namin is regarding the wastewater treatment that we had, wherein when we had the water collected, talagang it's clear. Clear talaga siya and without any odor.
So kumbaga we can use other resources po than yung use.
Yeah, actually kasi we also sort of not encourage the use in fact of some drops because we know the sodium hypochlorite in fact will turn out to be a pollutant in the environment. So mas ano pa din talaga yung natural way of disinfecting.
So ang way niyo po, sister, is using yung mga natural resources natin instead of mga commercially available na that could also be harmful to our environment, such as yung Sunrox. Yeah. Thank you, Sister Arce. Thank you again. So, yan, sabi nung anonymous attendee, thank you po, Sister Arce. So, another question. I think aside from St. Paul's Hospital of Iloilo, do you know of other hospitals that have already started or have incorporated on being a GGHH or are kung kunwari not in the Philippines, kumbaga someone we can inspire to become, as well as, of course, we know of SPHI po, pero other hospitals here in our country, meron po ba?
Yes, so actually po, for us, the St. Paul Sisters, we have 13 hospitals in the country. And each hospital has its own initiative, no? Kumbaga, different levels ng kami ng achievement namin. Because we are all members of Healthcare Without Harm. And in fact, we used to attend their annual conferences to learn more about being environmental friendly healthcare institution. So may iba-iba na level lang kami. And then I know also one hospital in Manila, the Amang Rodriguez, I think that's at the OH hospital. And also in Cotabato, we have the Arthur Pingoy, there's a private hospital, Arthur Pingoy Hospital. And some other, I know of one hospital in Davao. So, kumbaga pag nakikita-kita naman po kami sa Now, if we say about some hospitals abroad, I could recommend the Tzu Chi Foundation Hospital in Taiwan. And there's a hospital in South Korea. Forgot the name. But in fact, the CEO there was our first president of the Asia Advisory Council of Healthcare Without Harm. So these are the hospitals that somehow work emulating.
So it is truly a feat pala, 13 palang institutions from St. Paul po, no? As well as other hospitals, not just in Manila, pero yun pa sa ibang provinces natin. We have seen na this could be done talaga po. Pero siguro slowly but surely, we can achieve a more multi hospitals, a lot of more hospitals to join this collaboration po, no? So we have another question po from
Doktora.
Hi, Doc Sheila. Yes, go ahead po.
I started with the Healthcare Without Harm Southeast Asia because I was looking for the videos sa award ni Sister Arce at the St. Hospital. There are other two awardees in the Philippines, no? Aside from what Sister Arce mentioned about the other hospitals, Mary Johnston Hospital is for awardee hospital, and also Cotabato Regional Medical Center. Mayroon din siyang 10 Good Achievement Award. So there are bali tatlong hospitals in the Philippines who got awards from the Global Green and Health Hospitals. And also in Iloilo, I would like to share that there's another hospital who is also practicing, not a member of GGHH, but already practicing the strategies, no, na that GGHH presented, the 10 goals. No, I think it's Metro Iloilo Hospital, which I am also connected with. Dr. Ray Alindong, one of our founders, has already established this. No? We have organic disinfectants, and we have already the solar panels. So hopefully he'll be able to share also his experiences. But I was also convincing him that this hospital, the Metro Iloilo Hospital, can also be part of the GGHH family. But just as to let them know that Metro Iloilo Hospital is also becoming green hospital.
So okay, Doc Sheila, thank you for citing those hospitals. We would also like to commend those hospitals in becoming part of the GGHH. So yung Mary Johnston's, Doc, no, Metro Iloilo, part step by step, and I think Cotabato Medical Center. Tama po ba, Dr. Sheila? So yun, we would like to commend those hospitals as well. So another question from the audience, anonymous naman po again. What do you think could be challenges that we face in becoming a green hospital, especially dito sa Pilipinas po? Sa tingin nyo, bakit yung iba mahirap i-attain na to become a GGHH hospital po, sorry.
Siguro po the challenge talaga is yung sustainability. Kasi we know naman, yung sinasabi natin as Filipinos, yung nigaspugong, so kung hindi ngayon, tapos mamaya pag hindi na mag-follow up. So, kaya in our case, healthcare waste management is part of the orientation of the new staff. And then every so often, yung sige ng lecture, plus yung mga on the spot na checking talaga. And one of our programs natin ngayon is to do periodic waste audit.
Okay. Okay, thank you, Sister Arce. Doc Sheila, do you have any other inputs? So sustainability, no, Sister Arce, is challenge. Okay. Doc Sheila po.
Probably siguro initially the resistance. Kasi pag nag-shift ka, into nakagawa na yung certain practices, and then you shift into something new, probably a resistance. But I think the important thing is you have to educate, like what Sister Arce said. Sa staff pa lang niya, sa staff orientation, sinasabi niya na. So very important yung orientation. You educate other members or your staff first, and so that you will have an open and understand or grasp the intent. So the importance of the strategy. So I think that's resistance first, and overcome resistance by educating. it's part of in the 10 goals, the leadership strategy. It is part of the action plan that you have to educate.
Okay. So educate and awareness. That's how we can yung resistance to a change. Kasi it's a big change sometimes, Doc Sheila, no? Kaya may resistance talaga. So siguro last two questions since we're extending already, pero I think these two questions are important as well. So from Sir Jesus, from our viewer in Zoom, I think Doc Jesus, how can we involve the public in supporting the hospital initiatives in going green? How can we ask the public, or how can we entice them, or ask them to help us also?
Yung sa amin, we have posted sa entrance pa lang yung no plastic, no styrofoam. And then in the patient's rooms, then we have installed this color-coded waste bins. So again, educate pa rin the patients, educate the family. Mm-mm.
Educate
And,
awareness. Yes.
And of course, later on, we have one of our plans is to go to the community na to share. Yes.
Okay, Sister Arce. Doc Sheila?
So I agree with Sister Arce. Really educate. And of course, you have to walk the talk. Sister Arce, she's an inspiration to all of us. As you can see with her example, people as part of the community of us will be inspired to do the same. And for us doctors, you can be an inspiration to others as well. So that is in a way, you can entice them to be a solution, to become part of the solution and be, in the green community. So you have to be an example, educate, and be an example to your fellow doctors
So be an example to our fellow public and educate. Yun ang two things that we can do to help the public to support the hospital's initiative in becoming green. So Doc, I think last question na lang to. There are actually a few... Yes, ba?
Another way siguro is as far as we are concerned, is that we openly accept those who ask to come to benchmark. So from there, then we can share and para multiplier effect natin. They're able to do it in their own institutions.
So educate, then share the message, so that we can spread awareness of the GGHH initiative. Siguro last question from Sir Christopher Ray de Guzman, or Dr. Christopher Ray de Guzman. They just want to clarify we want to advocate use of natural resources like silver daw instead of Sorox. And then he would like to say that he would like to thank you po, Sister Arce and Doc Sheila, for emphasizing sustainability, hence natural products which are cheaper are advocated. So yun lang, I think, issue. He wants to clarify yung like silver po, Sister. Okay.
Ozonator po. Kasi kung sabihin silver, di ba silver in fact yung kay mga antibacterial na yun, mga silver content yun siya. So that is not even advised to be used.
Okay. Sige.
So in our case, we utilize the ozonator to treat water and other natural products, organic products.
More of organic po. Okay, yes. Organic natural resources. Okay, Sister Arce, Doc Sheila, actually make few questions pero kasi we're running out of time na talaga. Actually, we extended but I think that we need to emphasize on this talaga because it really affects our sector as well. So in behalf of the PCP and the viewers of this PCP Live, I would like to thank you, Sister Arce and Doc Sheila, for your time, effort, expertise regarding this condition. I mean, this GGH GGH, Global Green and Healthy Hospital. And hopefully those who are watching could spread awareness and be part of this collaboration. So before we end this health forum, may we now call on our last but certainly not least speaker to give us our closing message for this health forum. I would like to graciously welcome Dr. Paula Santamaria to give us our closing message, who is also part of the PCP Committee on Climate Change, Environment, and Health. Doc Paula.
Hi, hello, and good morning. This has been an insightful activity for all of us. And in behalf of the Philippine College of Physicians Committee on Climate Change, Environment, and Health, we wish to thank our prime mover, Dr. Sheila Sonza, and of course, our gracious guest speaker, Sister Arcelita Sarnillo. Thank you so much for sharing with us, for inspiring us, for moving us, okay, to be one of the advocates for global green and healthy hospitals. So in this forum, we could see that it is really true to form that as we treat our patients, we should always be conscious that our activity would always include treating Mother Earth always. So always at the back of our mind. So we cannot overemphasize on what Dr. Sheila said earlier, that climate change is the greatest global threat to life on Earth now. Unfortunately, for all of us, the healthcare sector, we who have sworn to first do no harm, and we who are mandated to take care of other people are the greatest contributor. In fact, it has been cited that we are the 5th greatest contributor of greenhouse gases that fuel climate change. And all of this translates to more than 7 million lives that are claimed every year. So those lives really matter to all of us. And as people wearing the white coat, we cannot go on treating our patients. So this time, we have to come out of our comfort zone and do something to prevent more lives to be taken. So again, it's very important because most of these deaths are happening on low to middle income countries where we are. So again, in behalf of the Philippine College of Physicians Committee on Climate Change, Environment, and Health, thank you so much to our media partners, of course, to the Committee on Social Media Communications. Salamat po masyado for this opportunity to share and spread awareness. Like what Sister said, you learn about this Global Green and Health Hospital. What we would like to do is a multiplier effect, share it, so that more and more of us would be on this. The only way forward to restore Earth, to restore health, is to restore Earth first. So magandang umaga po sa ating lahat.
Thank you po.
Thank you, Dr. Santa, for inspiring closing message for this health forum. Indeed, the health sector can play a vital role in making a difference. So it could be done by improving hospital designs, incorporating sustainable waste reduction and management strategies, sustainable use of our natural resources like energy and water, and utilization of products and chemicals that leaves minimal impact on our environment. Our goal is to champion and create influencing policies towards a sustainable and climate resilient healthcare for all. Let us all rally to have a global, green, and healthy hospital and be part of this collaboration and change. Thank you all for attending. But before we go, and thank you, Sister Arce, Doc Sheila, Doc Paula, and Doc Burba for being here. But before we go, we have certain announcements for our upcoming February events. Okay, Sir Nilbert, can we share the slide? Okay, so first we have this coming February 24 to 25, we have the second Internal Medicine Bootcamp, which will be held in the Philippine International Convention Center. This is part of our 2023 PCP Annual Pre-Congress entitled Must Know Hacks, High Yield Advice on Clinical Knowledge and Skills. So this is the second IM Bootcamp that will be held for our residents. And then on March 25, 2023, we have our Universal Healthcare Summit, understanding strategies and aligning perspectives. This will be via Zoom again on March 25. So yung UHC Summit. And I would like to all invite us to our 53rd Annual PCP Congress entitled Passion, Constancy of Purpose, Prudence in Internal Medicine. This will be held in the Philippine International Convention Center, or PICC, from May 7 to 10, 2023. So I think we have videos to present, Sir Nelbert, before we leave. So again, thank you all for attending our PCP Health Forum. Thank you for all the viewers and our media partners who continue to watch and support us through this webinar and social media. Thank you, Dr. Sheila Sonza, Sister Arce Sarnillo, Doc Paula Santa Maria, and Dr. Burba for joining us and enlightening us on Global Green and Healthy Hospital. Our next health forum will be next week. It will be on the health forum will be Usapang Urticaria. It will be with our speaker, an allergologist, Dr. Christy Pinoy Villamor. So I think we have videos. Po. Sir Nilbert, are we going to share?
Internists occupy a unique role in healthcare. They are experts in a spectrum of diseases and complex illness, earning the moniker the doctor's doctor. Internists use their vast knowledge, experience, and skill to identify the best possible treatment strategies, making them scientific puzzle solvers. They are proponents of extensive clinical research, evidence-based medicine, and continuing education, fueled by the commitment to provide high-value patient care that balances science and compassion. In 2023, the Philippine College of Physicians celebrates 70 years of excellence and service above gain. Driven by passion, constancy of purpose, and prudence in internal medicine. Take part in the 53rd Annual Congress of the Philippine College of Physicians on May 7 to 10, 2023 at the Philippine International Convention Center. Together, let's revisit all that we've become and move toward all that we can be. The Philippine College of Physicians is unstoppable in plying the road to 70, taking you closer to its 53rd Annual Congress, month after month. On the third leg of its pre-convention series of activities, the PCP invites you to take part in the Universal Healthcare Summit, Understanding Strategies, Aligning Perspectives, on March 25, 2023. The country's finest internists are called to join forces in driving the importance of universal healthcare by gaining more knowledge and insights on its implications in the practice of internal medicine, real-world experience in the local setting, the internist role as a UHC healthcare provider, financial structures and obligations of various Philippine government groups, and the challenges behind UHC. The road to 70 is just around the corner. Be there for the Universal Healthcare Summit to advance your understanding of strategies and align with current perspectives. See you on March 25, 2023. The Philippine College of Physicians, through the Committee on Media Communication and Health Forum, wishes to thank its media partners, social media followers, and participants. See you again next time, here on the PCP Health Forum.